treatment is very, very easily. Okay, we are going to do 2 entry points. Please turn it on like that. Okay, the first point to the contour, or to the cant of the eyes, around 25 degrees, we are measured around 3 centimeters. Okay, to avoid all the complications in that area, all the circulatory complications. I look in the nose, and I will do it my first line. Okay? My second line, we can do it. To look in the contour of the mouth, okay, or the chin. Sometimes when I had patients, they don't need the head foot, okay, I do 3 lines. Okay? The line that I will do here, I did here. Because most of the patients, when they can't, the head 4 is very nice. I don't need to fully up, okay? And I do this and this, okay? But in that case, we are going to do the protocolo, like is the protocolo from the laboratory, and the second, we are going to do it looking the chin, okay? The second point, the second entry point, okay? I will avoid all this area. It's full of vein, everybody knows, and also here is the nerves, okay? And this will be my entry point, okay? And I will do the line to look in the center of the head foot, of the head for to see the head of the eyebrow. Like that, okay? If we have some patient that this area is very deep, okay, I do in the deep area, okay? But in her case, I don't need it. It's quite good, okay? The only what we want is to lift it up the eyebrows, okay? The second one, the old technique, because some doctors tell me, but what is the difference? What you change the technique? What the laboratory change the technique? Keeping in mind, we are treatment with a solubilized product. If we have bruises, the bruises will stay inside longer than normally, because he spreads around, and the bruises will be bigger. Even if we do with 30 G needle, okay? That's the reason I prefer the cannula. It's more easily and it's more safe, okay? The old technique, I did a point here, look in the eyes, 2 centimeters. The another point was here. The point that I tell you out of level is in the contour of the eyebrow. This is ligament orbital, orbital malar, ancho orbital, and in this area, go to the bone, I put 0.0 ml, okay, to lift it here, okay? But we don't need, I recommend to do that if you had a lot of experience with the product and a lot of experience with the needle in that area, because if you make a bruises, will be very big bruises, okay? Okay, 25 degrees of the contour of the eyes, okay, around 30.5 centimeters. My first line, look into the nose. My second line, looking to the chin, sorry. Okay? I avoid almost 2 centimeters from the last part of the eyebrow, okay, and entering, and I look it to the medial part of the head for at the same time to the eyebrow, okay? In that area, we have some patients, they are deep here, especially the old patients, that they came to the clinic and they say, I have a line here over my nose. If you put hyaluronic acid, you don't change it. If you put Botox and she's very dropping, you don't change it. You have only 2 solutions, put fret or put GOURI, okay? In this line, okay? With 0.1 ml every 3 times, sometimes 4 times, disappear and the eyebrow is a little bit more. up. Of course, I do also the technique of the headphone. Okay, let's start. We are going to use 25 cannula plus 50, but if some of you uses GOURI, when the GOURI goes to the skin, it's very itching. Okay? Okay, if I have a patient I don't like too much and I don't want to come back, I do without anesthetic. Okay? But normally I put before anesthetic and I wait. In the moment that I do the anesthetic, I do the other side and I start. Normally I use it lidocaine, 1 ml. I will use it for all phase, 3 ml, 0.5 each line. Okay. And you know, some patients, some doctors, they was asking me, what we don't miss GOURI at the same time with the lidocaine, and we don't have to do it 2 times. Okay. It's very important, don't change the solubilized the product, you know, to maintain the quality of the product and to have the bigger results, okay? Normal, with 23 needle, okay? The second one. I saw her video before. I said, okay, fantastic, you're a good patient. She's quite good patient. If we don't have time after the treatment for questions, okay, everybody have my internet, my Instagram, okay? You can ask me whatever you want, you know? And also I will leave you my email if you want to see what we are doing new, our lever in our experience in the neck. Okay? Okay. We have to go superficial. Why we go to superficial? Remember the yellow fish. Okay? I want to spread in the dermis and goes down. Okay? If you are going superficial and you think you have a resistance of the skin, you press and that's it. Okay? I always like to pass the zygomatic ligament. You know, always. You know, Dr. Han don't do that, but I like it to do it like that, to pass the zygomatic ligaments to have more lifting effect. Okay, in retrograde, like everybody knows, soft to be homogenic, the anesthetic in the way. Let's do it. The another one, I'm going to put it like that to see, can you see better? Okay. Ligomatic ligamento. I'm going down, a little bit down, and I like that, you know, because when I do this fall, I'm sure I have the GOURI in all the way, okay? And when I take my syringe out, I'm sure I spread all that, like that, okay? Perfect. Are you okay?
Yes.
Who is better, Dr. Han or me?
Let's watch it again.
This is a bad question, eh?
Yes.
Okay, we continue. Remember here, we have the malar balls, okay? If the patient has malar balls, I recommend you before treatment the balls with enzymes, and after that with GOURI, and you will have amazing results, okay? I pass the ligament, okay, and I put my anesthetic. Okay, the rest. Actually, when I do thread, I put anesthetic with cannula, with 22, like that. It's more easily for me, and I prevent the bruises for the patient if I do with needle. As you see, hostia, no veo. As you see, the technique is very simple. It's not complicated technique. Okay. After you do the treatment, you don't have to massage. You don't need it because the product, with his quality, will spread a lot. He will spread in his way to working. Okay. The syringe comes like that. Okay. As you see, it's white, a little bit transparent. Even if you put like that many days, or you put like that many days, you will see the product is homogenic all the time. And this is quite important. We have 1.1 ml in each syringe, and we are going to do it 0.3 in each part. Okay? What I do, I leave for the last to the part that I want to lift it more, because I will have a little bit more GOURI in the last way, But what I'm going to do it, I'm going to start from the head for here, and the rest I'm going to put it in that part because I want to lift it here more. I want to shape her more, the contour of the face, and I want to shape to define his cheekbone. Sorry for my English. I have more Cuban accent, speak English than Spanish. Okay, slowly. I'm going to put 0.3. Okay, and when you are going to do it retrograde, you have to do soft and slowly to be all the products homogenic in the area. Okay? We got it? I don't pressure nothing else. You had a little bit of pain?
No, it's fine.
No, it's fine. Okay. I am the best. I know. No, Dr. Han is the doctor, has more experience in the world with GOURI. Okay. This is for me. I see more result when I do that. I spread all the skin up, okay? And I started like that. And I started to lift the skin, go on his way. I went very slowly. And I start again from the ligaments. And I do it again. Okay? It means I do 2 different levels between the ligaments and the up part of our mark. Okay? The rest, I'm going to do it like that. And again, I made the fall, and I started soft, slowly, homogenic, to be all the product in the same way, Okay? Some doctor, they ask me, now with the new technique, how you do here, in the canto of the eyes. I starting from here, okay? I don't have anything in my syringe. I will don't do anything. You go deep, okay? Touch the bone, and go up. And I have here. And I leave it there. Okay? Let's going to start from the head 4. Normally in the clinic, after that, we put a mask, cold mask, okay? Because I do this treatment very fast, so the patient realize we are treating a lot. Okay. Second one, remember in this area, I'm going to do 2 different layers. I start with normal layers, superficial, okay? I make the fold, you know. And when I pass the ligament, I start again a little bit more deeper, touching the ligaments and do it again. You know, for me, it's very important, especially with this product, that we can recover the way of the shape of the ligaments, you know, treatment in different layers of the ligaments to have more lifting effect, okay? The second, like the first I start, I always do the fold to flip all the line. I do soft, homogenic, I split, I feel it, I am here. Okay. Now from the another side, again, if you want to do this point, okay, you can do it from here. You go deeper to the bone, I am touching the bone, I put the cannula down, and I am here, okay? And in this area, if the patient has the ice brown very drop, you can put 0.5 without any complication. I have more than 1,000 cases. In his case, I leave a little bit more in the front to cover this area and to lift here that she needs. Okay?